guys, it's Lindsay from Empower Movement Physical Therapy. So we're going to start a series on back pain. So there's a ton of things that physical therapy can do to help you with back pain. But just to start this series off, I wanted to talk about some things that physical therapy cannot help for back pain, or some major warning signs that when you hurt your back that you really should go get this checked out, either in urgent care or in the emergency room. So let's say you have some significant back pain. If that is from a trauma, like a fall from a height, like you fall out of a tree or you fall off of your roof, there's definite possibility of a fracture. So I would definitely go get that checked out, get some x-rays, get that trauma looked at, especially if you have any underlying conditions such as osteoporosis or long-term corticosteroid use. So make sure you get that checked out right away. If you have back pain that kind of came out of nowhere, then you've got a little bit of wiggle room there, even if it's really, really severe. Or if it came from like what seemed like a really innocuous movement, like bending down to tie your shoe. If you got back up and you had like terrible back pain, it probably wasn't that going down to tie your shoe that was what caused it. I liken this to like when you've had a few too many drinks and it's that you blame that last drink for getting you drunk. Probably wasn't that last drink, it was like the 5 you had before that. That, last bend that you did is maybe what finally irritated the back pain, but it probably had been brewing before that. But it's probably not a serious injury that you need to go to the emergency room and get looked at. Other serious things that I would be aware of that you probably should also go to the emergency room for would be if you have some back pain with unexplained weight loss, with a history of cancer and you haven't had your screening done in a while, especially if you're over the age of 50. If you have some loss of control of bowel and bladder, or that you've lost sensation in the area between your legs if you were sitting on a horse and riding on a saddle, that's another major thing that you want to go get checked out. That can be a major spinal cord compression issue, so make sure you go to the doctor to check on those things. Otherwise, also, if you're running a fever and you know it's not necessarily from like a virus or something like that you may have, if you have back pain, fever, there's also a possibility of infection, so make sure you go get that checked out from a doctor as well. So if your back pain doesn't fall under any of those categories, it's very possible that it's an orthopedic issue that can be addressed with conservative treatment. So if you're not sure, you're welcome to always call us and ask. We'd be happy to talk you through that process. But in the meantime, again, if it's not one of those major things, you could be a very good candidate for some conservative treatment, which we'll talk about on a future video. Thank you.